I'm a general surgeon. My main area of expertise though is endocrine surgery, which is surgery on the endocrine glands, in particular thyroid, parathyroid and adrenal gland surgery. And that led to my research interest on pheochromocytomas. And pheochromocytomas are tumours which occur within the adrenal gland. The typical symptoms that a patient would experience with a pheochromocytoma are related to massive amounts of adrenaline and noradrenaline release. So the symptoms that can result from that include severe hypertension or significantly elevated blood pressure, headache, palpitations, an irregular heart rate, or sometimes even sudden death resulting from a cardiac arrest or a stroke. Currently, once we've detected a pheochromocytoma based on the patient's symptoms, their blood tests, and then radiological imaging, the only effective treatment really is surgical excision. In most cases for small tumours, we can now remove them laparoscopically or through keyhole surgery, whereas for larger tumours we generally would need to take a more traditional or open approach. Most patients get a very good response from surgery. However, the problem is about 10% of patients will have a malignant tumour. The only problem is we don't necessarily know at the time we've removed the tumour, or even when we're following up the patient for the first few years, whether or not their tumour is malignant. The research that I looked at was trying to develop a panel of biomarkers to help us determine which tumours have the potential to be malignant and which are likely to be benign. So my research involved microRNAs, which are very small fragments of RNA, which can inhibit the translation of RNA into its protein product. But the first step of my project was to see whether or not there was a difference of expression between benign and malignant tumours. So we used tissue from patients who had been followed up for at least a 5-year period and who did not develop any distant disease, and we classified them as having tumours that behaved in a biologically benign fashion. We then compared that to patients who had developed distant or metastatic disease within 5 years, and we were able to come up with a panel of 21 microRNAs which were differentially expressed between the two tumour types, so the benign tumour and the malignant tumour. And we've been able to demonstrate that the microRNA over and under expression seem to affect the growth of tumour cells, at least at a cell culture level. By overexpressing or underexpressing, we could speed up the growth of these tumours. It was a very exciting result because it means that we can potentially use that panel to help predict which patients are likely to have an aggressive tumour and which patients are therefore likely to develop malignant or metastatic disease down the track.